My name's Linda Blueworth. Welcome to the Nottingham Physio and Colonics Clinics here at Plainsview Surgery, Mapley. I'm a naturopath and registered colon hydrotherapist, and I've been in practice since 1990. I'd just like to give you an idea, to welcome you to our clinic, to show you some of the facilities we have here and to explain a little bit about colon hydrotherapy. Colon hydrotherapy is the introduction of warm, filtered water into the bowel, and we use approximately 75 to 80 litres of warm filtered water. Now, one thing that people really tend to get quite nervous about when thinking about having colon hydrotherapy treatment is the speculum and insertion of the speculum. So I'd like to show you a speculum and explain how it's inserted. So this is a single-use disposable colonic speculum, and as you can see, it's in two pieces here. This piece here is called an obturator, and that's purely to give it this rounded end to make it more comfortable for insertion. I use lots of lubricant, and I'll either use a chickweed cream lubricant, or I may use a calendula as a lubricant, calendula cream, natural products, non-irritating products. So plenty of cream as a lubricant. I insert the speculum, remove this piece. So the only part of the speculum that's actually inside the rectum is that there, what, 1.5 inches, maybe 2 inches. And then here on the outside of the body, I will attach the inlet tube, taking the warm filtered water in, and the outlet tube here, taking away the wastewater, and that goes directly into the sewage system. Before I insert the speculum, on new patients, I will always do a quick rectal exam, just with my finger. I need to ensure that there are no internal hemorrhoids, there are no obstructions before I insert that speculum. This is a diagram of the large intestine, or colon. It's approximately 5.5 feet in length, it's 1.5 inches in diameter, and it should be a hollow tube to allow the waste material to move in a clockwise direction, up here, along here, and down and out here. So we insert the speculum that I showed earlier, just inside the anus here, and then the warm filtered water is very gently pushed under low gravity around the bowel. So a little bit in, a little bit out, a little bit more in, a little bit more out, and so on, until we eventually get the warm filtered water and the herbs right into the cecum over here. I very often also use herbs to mix with the colonic water. Herbs such as licorice root, for example. Licorice root is what's called a saponin. It's a soapy herb, so it helps reduce surface tension in the bowel. So I would use licorice root on a person that had IBS, and if they had abdominal pain, to help relax the bowel and get it out of spasm. Sometimes, if I'm treating a person who is chronically constipated, I will mix some magnesium sulfate or Epsom salts with the colonic water to help peristalsis. Peristalsis is where the bowel contracts and relaxes, and it needs to be doing that to push the waste and the gas along and out. So sometimes on a very constipated person, I may begin the colon hydrotherapy treatment with the magnesium sulfate. And these are some of the products I recommend to help improve bowel dysfunction. So up here we have the golden linseeds, a natural remedy for constipation. And then down here we have the BioNutri's Ecodophilus, which is the probiotic, the multi-strain probiotic that contains strains of Bifidobacter acidophilus, Bulgaricus and Kefir. And across here, people who have lazy bowels, constipated bowels, capsules that contain Cascara sagrada, senna, cape aloe, ginger, garlic. And down here, the Solgar VM75, a very high quality, high strength vitamin and mineral one daily. And then we have the digestive enzymes here, the aloe vera, and the Dr. Tollinen's omega-3s to help with gut inflammation. So quite a wide variety of different natural products to help improve bowel function. Here at Nottingham Physio and Colonics clinics, we treat a wide variety of bowel dysfunction, but not just bowel dysfunction. Many people find when they've had a couple of colonic hydrotherapy treatments, their skin problems begin to improve, particularly eczema, dry skin. Obviously, it's very effective for the symptoms of irritable bowel syndrome, particularly abdominal bloating, abdominal pain, diarrhoea, constipation. Also helps improve indigestion, acid reflux. I've treated women who have had gynecological pain, and after a couple of colon hydrotherapy treatments, the pain disappears. Back pain, of course, sometimes if the bowel is very constipated and it's pressing on nerves in the lumbar area, it can cause back pain. So colon hydrotherapy can treat a very wide variety, not just of functional bowel disorders, but other health-related conditions.
Hello, my name's Kevin Booth. I'm the physiotherapist within the Nottingham Physio Colonics. I've been in practice about 20 years, initially training as an osteopath in my early days, and then about 10 years ago moved into physiotherapy. I treat a wide range of conditions, back pain, neck pain being the most common I see in this practice, but I also do treat sports injuries as well as anything musculoskeletal related, and then physiotherapy can be really helpful. The techniques I use within my practice go back to my osteopathic training days. That is manipulation, massage, interferential, ultrasound and acupuncture. These all help to restore normal function of the joints and muscles.